The time now 8:15. February is Heart Health Month. And joining us this morning is Dr. Martha Galati. She is the director of our Preventative Cardiology and Women's Cardiology Health Program here at OSU Wexner Medical Center. Doctor, thanks for being with us this morning.
Oh, thanks for having me.
I'm sure every month for you is Heart Health Month, but for those of us who don't think about it on a daily basis, who don't even know what our risks might be, where do we begin in determining our risk?
Well, I think it's important for everyone to know their risk, and it's just simple. Get an examination and make sure you know if you're at risk. Know what your blood pressure is, know what your body mass index is, and all that is knowing is your weight good enough for your height, or are you too heavy for your height, one or the other. Knowing your cholesterol, knowing your blood glucose, or your sugar level. And lastly, knowing what your waist circumference is. And it's not where you have your jeans sit, because we often sit them lower than your true waist.
Right.
So you should have your waist circumference measured. And for a woman, you don't want your waist to be above 35 inches. And for a man, you don't want your waist circumference to be above 40 inches. Otherwise, you're at risk for both diabetes and heart disease.
That seems like that's kind of an emerging marker that we're hearing more and more about. Why is that such a risk?
Well, it seems like there's a body habitus, or a type of body that walks into our room. And I always say it's like when your stomach enters the room before the rest of you. That tells us that you're at risk for diabetes. If you're at risk for diabetes, the problem is you're at such a greater risk for developing heart disease in the future. So just a simple measure like that, or sometimes we say we just eyeball a patient and we can tell that you're at risk for both of these diseases.
Good to know. So once you know this information, which I think can be intimidating, why a lot of people don't go to see their doctor, they're scared to find out, there are some very good medications, very good treatments to get those numbers in line.
Yeah, and I would actually say more than medication, the treatment tends to be lifestyle first and foremost. So there's simple things people can do. If it's as simple, if your blood pressure's high, maybe lowering the salt in your diet, or exercising more, or losing weight. Same with cholesterol, simple things of changing your diet, increasing the fruits and vegetables and fiber in your diet. There's simple things. Don't think that if you just go to the doctor, you're going to end up on a medication. In fact, I would say and hope that most people will end up with lifestyle changes.
Sure, that medication can be the last resort. Before we let you go, let's talk about the fact that, you know, it is emerging. I think many people realize now that this is the #1 killer of women.
Yeah, it's the #1 killer of women, and in fact, 1 in 3 women will die of heart disease in their lifetime. When you think about breast cancer, 1 in 30 women will die from breast cancer. So not to minimize that disease, but to understand the importance of heart disease and heart disease prevention.
Knowing those numbers and that information, I know I'm at greater risk just for hereditary factors, so it needs to be something that you know early and that you keep in mind. It could save your life.
It absolutely can.
All right, Dr. Galati, thanks so much for being with us this
Thanks.
morning.